What is up, my friend? In this video, we are diving into the pathophysiology, signs and symptoms, and the nursing interventions for hypokalemia or low potassium. Now, don't worry, we will break it down like we always do for you, step by step, and we'll make sure that you know the pathophysiology or what's happening in the body that could be causing hypokalemia. Fully understanding the patho is the foundation for critical thinking throughout nursing school and through hypokalemia and all other med-surg disorders. Now, you want to be able to apply what you're learning, right? So not to worry, we've got you covered there, my friend. You'll fully understand what is causing hypokalemia and why those symptoms are happening. Now, that's why we walk through the critical thinking behind it all, step by step for you. So you'll be a lot more confident for your nursing school exam on hypokalemia after watching this video. And of course, I have a free cheat sheet for you to help you learn things faster in nursing school. So be sure to stay until the end of the video and I will let you know where you can snag that. Now hit that subscribe button and click the notification bell and let's dive in. Okay, so potassium is probably the most important electrolyte you need to worry about. It has a very narrow normal range, and if it goes out of that range, bad things can happen very quickly. Now, we don't want that, right? So we want to prevent those bad things. That's why it is monitored so closely. So the normal range of potassium is between 3.5 to 5 milliequivalents per liter, and hypokalemia occurs if that value drops below 3.5. Now, there are many things that can possibly cause a decrease in potassium level or hypokalemia, and these things include certain medications, things like diuretics, insulin and corticosteroids, an increased potassium excretion, so getting rid of too much potassium, decreased potassium intake, not consuming enough, or increased aldosterone production can also cause hypokalemia. Okay, I know I said I wouldn't just give you a list and have you memorize it, of course. So let's talk about these. Let's break them down and dive deep into them. Are you ready, friend? Let's do it. Hypokalemia can be caused by certain medications, like we said, diuretics, insulin, corticosteroids. Now, many diuretics cause potassium loss. So when a patient uses those diuretics, there is a lot of potassium that is kicked out into their urine. Insulin is another medication that can cause hypokalemia. When insulin is given, it actually helps to move potassium from outside of the cell to inside of the cell. So when potassium moves outside the cell to inside the cell, it drops the potassium level in the blood because that potassium is just hiding away inside the cells. Now let's talk about corticosteroids. The main corticosteroid that impacts the potassium level is aldosterone. Now, aldosterone has three main jobs. It tells the kidneys to hold on to sodium, hold on to water, and get rid of potassium. So if a patient is receiving corticosteroid medications and their aldosterone production has increased, then all that aldosterone is going to the kidneys and telling them to, you guessed it, get rid of potassium. And this will cause the potassium level to decrease. Now, alrighty, we've covered medications. Now let's talk about some things that can cause increased excretion of potassium. So getting rid of too much potassium. Increased potassium excretion can, of course, cause hypokalemia because it's actually getting rid of potassium itself. So things like diarrhea, vomiting, sweating, and suctioning can cause potassium loss because in all of those cases, we're getting rid of body fluids and therefore potassium is being lost. When potassium is being lost faster than it can be replaced, you get hypokalemia. Now, decreased potassium intake is another big one. So a low potassium diet can also cause hypokalemia simply because there's not enough potassium intake into the body in the first place. So if we aren't getting enough potassium in our diet, it can cause hypokalemia. And now finally, increased aldosterone production can also cause hypokalemia, kind of like we talked about before. Here's where we get into some critical thinking. Now, of course, my friend, I wouldn't leave you hanging on this one. It is important to fully understand how this works. All right, you ready? let's dive into aldosterone and how this relates. Aldosterone is released by the adrenal glands, and aldosterone has three main jobs, like we said. Tells the kidneys to hold on to sodium, hold on to water, and get rid of potassium. Bingo! So if there's too much aldosterone production, that aldosterone is going to go tell the kidneys to get rid of more and more potassium, right? So what do you think is going to happen? Of course, the potassium level is going to decrease. This will lead to hypokalemia. Now, what is one major disorder where there's too much aldosterone release? Cushing's syndrome. Yes, during Cushing syndrome, there is an increase in those corticosteroids, aldosterone being one of them. So when corticosteroids increase, aldosterone increases too, and potassium gets kicked out. So that is the pathophysiology and the causes of hypokalemia. Certain medications, like we said, diuretics, insulin, and corticosteroids, increased potassium excretion, decreased potassium intake, or an increase in aldosterone production. Now, before we dive into what hypokalemia might look like in your patients or their signs and symptoms, let's recap about what potassium does. Now, potassium has two major roles in the body. Potassium helps the muscles contract, and it keeps the heart pumping. So keep those two things in mind, because that is going to make learning all of these signs and symptoms for hypokalemia a whole lot easier for you. So the major signs and symptoms of hypokalemia are a potassium level less than 3.5 milliequivalents per liter, cardiac arrhythmias, a weak, thready pulse, decreased reflexes, muscle weakness, GI symptoms such as constipation, nausea, vomiting, or a paralytic ileus, as well as respiratory depression. Now, there also might be ECG changes too. So let's dive into these signs and symptoms. Now, I know what you're thinking. Christina, wait a minute. You said you wouldn't give us a list to memorize. No, don't worry, friend. I'm not just gonna give you a list. We are gonna dive deep into these signs and symptoms and really get into the critical thinking behind it so you can actually remember them. So you're actually gonna understand that list here in a minute. So hypokalemia is actually defined as a potassium level of less than 3.5 milliequivalents per liter. A normal potassium level, like we said, is 3.5 to 5 milliequivalents per liter. So anything less than that would be considered hypokalemia. Alrighty, now the first category of symptoms we'll talk about are the cardiac ones, cardiac arrhythmias, and a weak and thready pulse. So like we said, potassium plays a huge role in regulating the heart. It keeps it pumping, but regulating the electrical system too. So when there is not enough potassium, what do you think is going to happen? Well, let's do some critical thinking, right? If there's not enough potassium in the body, and potassium is vital to the heart, right? Like we said, to keep it pumping and functioning properly, well, what do you think is going to happen? Well, the heart will have a harder time functioning because without that potassium, it can't do its job very well. So this can lead to cardiac arrhythmias and a weak and thready pulse. Now, let's talk about the second category of symptoms, which are those muscle symptoms. And these include decreased reflexes, muscle weakness, GI symptoms, like we said, constipation, nausea, vomiting or paralytic ileus, and respiratory depression. Now get ready, friend. Let's do some more critical thinking with this one here as well. Like we said, potassium plays that key role in helping the muscles contract and work properly. And so when there's not enough potassium to help the muscles function, they will not work well. And the key word to remember here is weakness, muscle weakness. So without that potassium, the muscles will be weak. And this goes for all the muscles in the body, the skeletal muscles, the GI muscles, and of course, the respiratory muscles as well. You see the connection here? Now, let's take another look at those signs and symptoms, right? Decreased reflexes, muscle weakness, GI symptoms, that constipation, the nausea, the vomiting, paralytic ileus, and respiratory depression. All of those things have to do with what? Oh, wait, don't worry. They all have to do with what? I know you know it, my friend. Muscles, muscle weakness. Remember, muscle weakness. So when there's not enough potassium to help the muscles to contract, the muscles will just be weak. So this muscle weakness will cause those decreased reflexes, the GI symptoms, right? Constipation, nausea, vomiting, paralytic ileus, where there's an obstruction because the bowel stopped functioning, the GI tract stopped functioning, and respiratory depression because the respiratory muscles are now weak. Now, some ECG changes may happen as well, like those cardiac symptoms like a flat T wave, ST segment depression, and an elevated U wave. So compared to a normal ECG, those are the changes that you can expect to see in hypokalemia. And those, my friend, are the major signs and symptoms of hypokalemia. Potassium level less than 3.5 milliequivalents per liter, cardiac arrhythmias, weak and thready pulse, decreased reflexes, muscle weakness, like we said, of course, GI symptoms, that constipation, nausea, vomiting, paralytic ileus, as well as, of course, respiratory depression and ECG changes. All right, so we have covered the pathophysiology of hypokalemia, and we dove deep into those signs and symptoms too, so that you will be able to be super ready now for your nursing school exam on hypokalemia. Now let's go over one more thing. We got to go one step further into the nursing interventions and the assessments that you will do as the nurse with a patient with hypokalemia. Now, the interventions for hypokalemia fall into three main categories: monitor, reverse, and prevent. So let's dive into each one of these categories to make sure that we fully understand them. Now, let's start with monitoring. This one is super important. Now, you must continue to assess your patient. Now, like we said before, potassium plays two major roles in the body: helps the muscles to contract, and it keeps the heart pumping. So you need to make sure that you're assessing your patient's cardiovascular status. Make sure that they have an ECG monitor on. Assess their respiratory, their renal, their GI, and their neuromuscular status. And really, you'll just need to be assessing every body system because, of course, potassium affects it all. But the main takeaways that I want you to remember are that the patient should be on a cardiac monitor, and you need to keep a close eye on their cardiac system and respiratory status. Now, along with these assessments, you'll need to be monitoring their lab values as well, of course. So make sure to draw and check your labs per your facility's policy to make sure that the interventions are working properly. Now, the second category is to reverse it. Now, where your goal here is to actually fix the hypokalemia, of course, we wouldn't leave the very important electrolyte potassium low. No, we need to fix it or reverse it. And the main ways that we can do this is to give potassium either through an oral potassium supplement or through an IV. Now, there's the key point that you've got to know here. Super important. So listen up. You will never give potassium through an IV push. It should only be given if it has been properly diluted, and you should always give it using an IV pump to ensure that the dosing is correct. Giving IV potassium is super dangerous because too much of it can stop the heart. So if you do give potassium through an IV, you must make sure it's diluted properly, that the dosage is correct, and that the IV pump is set correctly. And finally, you'll need to do some things to help prevent this from happening again. And the two main ones are patient education and altering the plan of care. So you'll need to educate your patient on consuming more high potassium foods and watching for the signs and the symptoms of that hypokalemia that we talked about earlier. It's important for them to know those symptoms so that they can seek medical care early if those symptoms of hypokalemia occur. You'll also need to work with the rest of the healthcare team for your patient to change their plan of care if needed. Now, for example, if your patient is on a loop diuretic without potassium supplementation, that might need to be changed. And those, my friend, are the major nursing interventions for hypokalemia. You will monitor your patient, reverse the problem, and prevent it from happening in the first place. So you'll continue to assess all of the body systems, monitor the ECG, and assess the lab values. You'll need to reverse that hypokalemia by giving potassium, and then of course help prevent it from happening again by patient education, educating them on the signs and symptoms of it and how to prevent it, and then altering the plan of care. And now, of course, there's 3 ways that I can help you more through nursing school. Number 1, be sure to download this nursing school study checklist that I have for you that walks you through how to study in nursing school step by step. And be sure to check out our nursing school boxes that we have available for you. They are packed, and I mean packed, with resources to help you succeed in nursing school. You are going to love them. And of course, if you want me to hold your hand throughout your nursing school journey, you know that that is what I am all about. So don't miss out on joining the NursingSOS membership community. It is filled with step-by-step nursing lectures to help you understand everything you need to know for nursing school faster and easier so you can be more prepared for your exams. Now, the links to all of those things are down below in the description. And if you like this video, make sure that you hit that like button, leave a comment below to let me know that you loved it. I love hearing from you. Share it with your friends who also might be studying hypokalemia as well. And of course, subscribe and hit that notification bell so you never miss a video. Click on one of these videos right over here so you can keep rocking nursing school. And as always, my friend, go become the nurse that God created only you to be. And I'll catch you next time on the Nursing School Show. Take care. Bye-bye.